Hi and welcome to Plexus Ortho. My name is Dr. Kanan Kumar and I am an orthopedic consultant at Plexus Ortho. Today we're going to discuss about MCQ number 201 and 202 that we discussed, we put up in the Telegram channel. So the first question goes as such. One is, a 25-year-old male came with pain in his right thumb after a fall. So what is the diagnosis? You can clearly see here that there is something wrong with the thumb. You can see that there is a triangular piece of fragment of bone here, and the rest of the bone seems to have subluxated out of the trapezium from it. So therefore this is a intra-articular fracture of the proximal part of the metacarpal base. So what fracture is this? This is called as Bennetts fracture, right? What is a Rolando's fracture? A Rolando's fracture, I'll just show you an image later on. So this is the base of the metacarpal and this is the trapezium. Bennetts fracture is where there is a fractured triangular piece of bone here along with the ligament. It is attached back, and this is attached to the APL tendon, and therefore it gets subluxated, just like how it has happened here. Rolando's fracture is an intra-articular fracture. It does not get subluxated because it is fractured equally on both sides, in this side, that is the volar side, and the dorsal side as well, and therefore it is intra-articularly fractured and remains in place. So this is called as Rolando's fracture. What is Chauffeurs fracture? All of you know what a Chauffeurs fracture is. Distal radius styloid fracture. Styloid radius fracture is called Chauffeurs fracture, and Barton's fracture is an intra-articular distal radius fracture with subluxation. I will show you some images in the slides coming up. So the second question is a continuation of the first question which we asked, which is which muscle is causing displacement of this Bennetts fracture. So all of us know by now that the muscle which causes the displacement of this is the abductor pollicis longus tendon. So what tendons form the first compartment? Abductor pollicis longus and extensor pollicis brevis. The abductor pollicis longus and extensor pollicis brevis forms the first compartment. What is other clinical significance of the first compartment? Dequerent stenosynovitis occurs in the first compartment. So these are the two clinical significances and the questions that may be asked with regards to the first extensor dorsal compartment. Now, so the answer is therefore abductor pollicis longus. So the answer is abductor pollicis longus, which is the muscle or the deforming force which subluxates the base of the thumb fracture. What is Rolando's fracture? We just described Rolando's. Rolando's is also an intra-articular fracture. So Bennetts is an intra-articular fracture, and Rolando's is also an intra-articular fracture with multiple fragments, intra-articular this thing. This piece becomes separate where it is attached to the APL, and therefore the deforming forces on the bone does not take place. So in Bennetts fracture, the deforming forces take effect because this piece, where APL attaches, is intact along with the whole of the shaft, and therefore the effect of the APL deforming forces take place. So therefore there is a displacement in Bennetts fracture, whereas there is no displacement in Rolando's fracture. So both are intra-articular fractures. Remember this. Both are intra-articular fractures. We had a couple of more named fractures in the question. One was a Chauffeurs fracture. All of you know what a Chauffeurs fracture is. It's a radial styloid fracture. Why is it called a Chauffeurs fracture? Previously, in olden days, about 100 years ago, when they used to start the car, so it used to jump start, and it used to hit the distal radius on the styloid process and break or cause fracture there, and therefore this was called as a Chauffeurs fracture. Remember, Chauffeurs fracture is a distal radius styloid fracture, radial styloid fracture. Radial styloid fracture is called as Chauffeurs fracture. What is a Barton's fracture? Barton's fracture is where there is an intra-articular fracture of the distal radius with subluxation of the carpus. So this is how it happens. This is a lateral view of the radius. So you have the carpus here. You have an intra-articular fracture of the distal radius, and this slips out along with the carpus like this, and this is called as the Barton fracture. What is it called? Barton fracture. 90% of the cases sublux volarly, like in this case, and then it is called a volar Barton fracture, and if it subluxes in 10% of cases dorsally, it is called as dorsal Barton fracture. So Barton fracture is basically an intra-articular fracture of the radius with the subluxation of the of the carpus, either volar or dorsal side. Volar side is called as volar Barton fracture and dorsal side is dorsal Barton fracture, and 90% of the cases are volar Barton fracture. This X-ray is put up very commonly because it's a very common fracture that happens in general population, and therefore you must be well versed with it. So to end this, let us go ahead and discuss a few of the named fracture of the upper extremity. There are multiple named fractures throughout the body, but let's go through some of the named fractures of the upper extremity. We will catch up with the named fractures of the lower extremity at a later point. What is a Hill-Sachs lesion? All of you know. Hill-Sachs lesion is a lesion that occurs when a repeated dislocation of the shoulder occurs, and there is an impaction in the posterior-medial portion of the head. That is called as Hill-Sachs lesion. This occurs in anterior dislocation of the shoulder. If the same thing occurs in the posterior dislocation of shoulder, the impaction occurs in the anterior-medial aspect of the humeral head, and this is called as reverse Hill-Sachs lesion. So Hill-Sachs and reverse Hill-Sachs lesions, remember it. Hill-Sachs lesion occur in the posterior medial part of the humeral head. Reverse Hill-Sachs lesion occurs in the anterior medial portion of the humeral head during posterior dislocation of the shoulder. Bankhart's lesion, all of you know, it's an anterior inferior lesion of the labrum along with the anterior inferior portion of the ligament, that is the inferior glenohumeral ligament, which is damaged, and this also causes repeated anterior shoulder instability or anterior shoulder dislocation. What do you know about Holstein-Lewis fracture? Holstein-Lewis fracture is a lower third, mid-third junction humerus fracture, and the fracture kind of presses onto the intermuscular septum and can press into the radial nerve and cause radial nerve neuropraxia or radial nerve injury, and this is called as Holstein-Lewis fracture. What is a Galeazzi fracture? Galeazzi fracture, remember, is a distal one. The fracture is a distal radius fracture with DRUJ dislocation or distal radio-ulnar joint dislocation. Distal radial fracture with a distal radio-ulnar joint dislocation. What is a Monteggia? It is an ulnar fracture with a radial head dislocation. It is opposite in the proximal side. Radial head dislocation. The opposite of it happens in the proximal side. So ulnar fracture plus radial head dislocation is called Monteggia fracture, whereas distal radius fracture plus DRUJ or ulnar dislocation in the distal part of the forearm or in the wrist joint is called as Galeazzi fracture. So esexilloplasty can occur in the forearm, where the radial head fracture or dislocation occurs with the disruption in the interosseous membrane between the two forearm bones. So radial head dislocation with disruption in the interosseous membrane between the two forearm bones is called as esexilloplasty. Colles fracture, all of us know, is an extra-articular distal radius fracture with dorsal displacement of the distal radius. So Colles fracture is dorsal displacement of the distal radius. Smith fracture is a reverse. You have an extra-articular fracture with a volar displacement of the distal fragment. Barton fracture we described. It's an intra-articular fracture of the distal radius with subluxation of the carpus. It can be either volar or it can be dorsal. Bennett fracture we just discussed. Bennett fracture is where there is a small piece of fracture, bone fractured, and an APL deforming, abductor pollicis longus, subluxes the thumb or the first metacarpal, and this is called as Bennett's fracture. Rolando is an intra-articular fracture where the APL's deforming force do not act, and therefore it remains in place without subluxation of the first metacarpal. So these are the named fractures. We will discuss this in greater detail in another video. So some of the named fractures that, now let me tell you again, are Hill-Sachs lesion in the humeral head during dislocation, Bankhart's lesion also during anterior dislocation, Holstein-Lewis lesion which causes that is a middle third and lower third humerus fracture with radial nerve compression is called Holstein-Lewis fracture. Galeazzi fracture is a distal radius fracture with ulnar dislocation. Monteggia is a ulnar fracture with a radial head dislocation proximally. Esexilloplasty is a radial head dislocation with interosseous membrane disruption. Colles fracture is an extra-articular fracture of the distal radius with dorsal displacement of the fragment. Smith fracture is an extra-articular fracture of the distal radius with volar displacement of the distal fragment. Barton fracture is an intra-articular fracture of the distal radius with carpal subluxation. Can be volar or dorsal, more commonly volar. Bennett fracture is an intra-articular fracture of the thumb with deforming forces of the abductor pollicis longus acting on it and pulling on the first metacarpal. Rolando's fracture is an intra-articular fracture without the deforming force of the abductor pollicis longus. So if you see subluxation of the first metacarpal, it is Bennetts fracture. No subluxation, it is a Rolando fracture. So with that, we come to an end of the discussion of the MCQ number 201 and 202. My name is Dr. Kanan Kumar. Thank you for listening to me, and this is Plexus Ortho. Thank you very much.